Health Watch Leeds, Inclusion for All, Action Hub. 30th of March, 2021. Zoom meeting. Track 1. Title and track index. Track 2. Attendance, apologies, and abbreviation list. Track 3. Part 1. People whose first language is not English. Track 4. Part 2. Current provision of interpreting and translation services. Track 5. Part 3. Impact of the withdrawal of BSL Health Access Interpretation Service. Track 6. Part 4. Pick up actions from the last meeting. Track 7. Focus of next meeting and roundup. Attendance. The following is a list of names, organisations and job titles of those who could attend this meeting. Tatum Yip, Community Project Worker, Health Watch Leeds. Jonathan Phillips, Board Director, Health Watch Leeds. Gemma O'Connell, Admin and Project Support, Health Watch Leeds. Laura Phillips, BSL Interpreter. Richard Jackson, BSL Interpreter. Rosie Horseman, Lead Nurse for Patient Experience, LT-HT. Nahida Hussain, Deputy Manager, Advonate. Sutwant Rate, LT-HT and HARP or HARP Volunteer. Helen Butters, attending on behalf of Sharon Moore and Fiona Coop. Involvement and Communications Team, NHS Leeds, CCG. Emily Davison, Nurse for Health and Facilitation Team, LYPFT. Manshu Leun, Baishi Red Chinese Seniors Club Project Chairman. John White, Lead Nurse of Patient Experience, Interpreting and Translation and Complaints, LT-HT. Jason Vesey, CEO, V Recruitment. Zaira Khanum, covering for Karen Fenton. Physical and Sensory Impairment Worker, Forum Central. Andrew Barnes, Sensory Support and Outreach Officer, Deaf Blind UK. Abigail Olelai, Project Worker, Voluntary Action, Leeds, BME, Hub. Alison Potts, Health Watch Volunteer and Person with Lived Experience. Salima Elzuki, Migrant Community Networker, Leeds Migration Project. Wendy Cork, covering for Luke Howard, Development and Partnership Director, Advonate. Carl Proud, Project Officer, Leeds Hearing and Sight Loss Service. Charis Green, Leeds Society for Deaf and Blind People. Diane O'Connell, Person with Lived Experience. Apologies. The following is a list of names, organisations and job titles of those who could not attend this meeting. Alison Conyers, Lead Professional for Learning Disabilities and Autism, LT-HT. Christina Jessup, Manager, the Leeds Hearing and Sight Loss Service. Daniel Wootom, Senior Project Analyst, Leeds Care record. Dabani Ghosh, Manager, Association of Blind Asians. Elizabeth Micklethwaite, Business Manager, NHS Leeds, CCG. Fiona Coop, Primary Care Commissioning Manager, Leeds, CCG. Heather Thrippleton, Patient and Experience Engagement Lead, LCH. Henriette Mahmani, Leeds Migration Project Coordinator, Leeds City Council. Jessalyn Mahoney, Health Improvement Principal, Personalised Care, Jez Coram, Learning Disabilities Development Worker, Forum Central. Julie Royal Everett, Strategic Health Facilitator, LYPFT. Karen Fenton, Operations Manager, Forum Central. Karen Shakespeare, Senior Project Manager, Leeds Care Record. Christina Koslowska, Head of Patient Experience, LT-HT. Lisa Smith, LCH. Nicola Gaulier, Content and Communications Manager, Mindwell. Pesha Thornton, Autism AIM Coordinator. Saeed Ahmed, Patient Experience, LYPFT. Jane Grant, Advice and Access Manager, Leeds City Council. Stuart Morrison, Team Leader, Healthwatch Leeds. Hannah Davis, CEO, Healthwatch Leeds. Toshal Bhatia, Service Manager, Health for All. Zoe Liebert, Engagement Officer, Forum Central. Alison Sherry, Patient Experience, LT-HT. Abbreviation list. Accessible Information Standard, AIS. Healthwatch Leeds, HWL. Leeds Hearing and Sign Loss Service, BID. Leeds City Council, LCC. Leeds Community Health, LCH. Leeds Teaching Hospital Trust, LTHT. Leeds and York Partnership Foundation Trust, LYPFT. National Federation of the Blind, NFB. NHS Leeds Clinical Commissioning Group, Leeds CCG. Terms of References, TORS. Leeds Care Record, LCR. Friends and Family Test, FFT. Leeds Society for Deaf and Blind People, LSDBP. Health Access for Refugees Programme, HARP, or HARP. Part 1. People whose first language is not English. Their experience of accessing health or social care services during COVID. 1.1. Zaira Khanum shared her experience of working with interpreters in Leeds. Zaira firstly raised that interpreters do not ask whether people have a sensory impairment and assume that they can hear interpreters clearly, resulting in patients not understanding and some feeling embarrassed to ask interpreters to repeat the interpretation. This has raised a question of what training is given to interpreters around invisible disabilities, such as a hearing aid hidden under a hijab or turban. Professionals use a lot of jargon that people, whose first language is not English, do not understand. Interpreters need to check that the individual understands what is being said. Zaira gave an example of a carer that she was supporting who was trying to access support. The individual did not know the term carer can mean both paid and unpaid. They consequently did not identify themselves as a carer when asked. If Zaira had not intervened, they would have lost their carer's assessment. Could there be interpreting specialisms, so that the interpreters are familiar with what jargon they are using and be able to make information clearer? Another example is at Leeds Dental Institute. The client found there was too much background noise to hear with a hearing aid. He became too overwhelmed and walked out. After this, they discussed that he could have taken his hearing aid out and used a BSL interpreter for his appointment. Zaira has experienced a GP claiming it cost them to arrange interpreters for her mum. The organisation she previously worked for had their own interpreting service due to some GPs claiming they couldn't provide interpreters in their budget. Tatum checked this out with a Leeds CCG prior to the meeting. There is no cost to the GP to arrange an interpreter. The contract is being delivered by Empire Language, and they should be able to provide language and BSL interpretation service to the GP with no cost. There has never been a cost to the GP. There is clearly a communication issue that GPs do not know this service is available. Zaira thinks it would be good to embed this in staff training, especially reception staff. Action 1. If anyone has complaints about the interpreting service in a GP practice or quality of the interpreter, please note the name of the practice, date, and time of the appointment, and feedback to Leeds CCG so they can investigate this. Action 2. Tatum to invite Empire Language to this meeting so that they can answer questions directly. Zaira asked, how does interpreting service identify what language is needed for interpreting if someone does not speak English? Action 3. Helen to find out this information for Zaira to share in the Forum Central bulletin. Zaira mentioned that Stacey from Forum Central wanted to share what the Communities of Interest Network are doing to support people whose first language is not English. Lots of people are communicating through WhatsApp and recorded videos, as this is their preferred and most accessible form of communication. Communities of Interest have small grants available to small community groups that translate key information in different languages and using the correct formats. Action 4. To publicise this information to the Inclusion for All network. 1.2. Sutwant shared that there are several dialects in Punjabi, and so it can be difficult to understand the interpreter. It is important to ask what people's preferred dialect is. 1.3. Nahida shared her personal experience during COVID. Patients were not allowed to bring family members with them. She was told that she could bring her husband for the procedure, but not stay there. They were told an interpreter would be provided. When she got there, she was asked to stay instead of getting an interpreter, as it would take too long to arrange one. This was her first time being out of the house due to COVID, and she was at the hospital for 9 hours, with 3 more hospital visits over 4 consecutive days. She asked again if they have access to Language Line. They said no. They said that Language Line, interpreter on wheels, does not work. She was only there to help with the language barrier, which Language Line could have dealt with to prevent her from being around vulnerable people and putting them at risk. As an advocacy organisation, 153 people have been supported with language barriers. It is not just the language barrier that is the issue, but also culturally. She gave an example that when a local councillor of a certain identity that matched a particular area spoke about getting the COVID vaccine and why it was safe to use, people could relate and understand, because they were using the right dialect and cultural influences. Advenet are using LCC for long-planned appointments. Short-term, we are using Language Line. also using resources among our staff. Not all the dialects are available to choose. She gave an example that her husband can understand some dialects that are not his own dialect, but the interpreter may not understand him. Action 5. Question for everyone. What are other people doing in terms of bridging those gaps, and can we work together to share positive experiences and how we achieve them? 1.4. Salima shared 2 experiences. Salima described a number of serious problems experienced by her and others about accessing health and social support during COVID. They related to diabetes, pregnancy, and back pain. They concerned both hospital and GP contacts. Action 6. Tatum to meet up with Salima to talk about the impact of delayed treatment and get these addressed by the different organisations. Wendy shared the following link for health complaints advocacy. https://how-we-health-complaints-advocacy. Health complaints advocacy is for everyone who wants to make a complaint against NHS services. Part 2. Current provision of interpreting and translation services. 2.1. LT-HT. John White. Hospitals must provide translation when required, and provide an interpreting service at any point in someone's care. LT-HT have an interpreting webpage on their website. The webpage can be translated using the Browse Aloud function in over 200 languages. LT-HT can book different dialects if they know what it is. They also have COVID information leaflets available in other languages and videos. Face-to-face interpreters are only allowed in exceptional circumstances, which is usually the case for BSL, but there are ways around face-to-face, such as a phone call or an app. The Language Line Interpreter on Wheels has been highly promoted and is available in 52 locations. This will go out to non-clinical areas as well. Staff do not always know what is available to them or check their emails for information, so they need to tackle that. The video interpreting app also has BSL at 200 languages via the audio function if face-to-face is not available. They are supporting the vaccination centres, so there is an interpreter on wheels at Ellen Road and Thackeray. BSL interpreters are there on a Monday, Wednesday, Friday and Saturday. The national booking team will put BSL on the booking form. On the physical action summary document, there is a table of the number and type of interpreting appointments over the last year. LT-HT have a deaf and blind service to help people who are both deaf and blind, pick them up and take them to appointments and take them home again. They do not have a great method of getting feedback from service users, so they are working on this. Want to get feedback from friends and family members too. Translation availability and quality of interpretation is monitored by the interpreting company. They have a new hearing and balance centre. 2.2. LCC. Tatum introduced LCC Interpretation Service. LCC interpreting provision is providing interpreting and translation services. An individual can book interpreters through staff. Charging will go back to departments of the council or the service requesting it and is free to the clients. Use both face-to-face and telephone interpreters. Friends and families are generally not accepted for interpretation. The Council will not pay for interpreters that are brought in externally because their own interpreters go through a rigorous recruitment process and DBS checks to ensure their quality. The most requested languages have been Eastern European languages, followed by South Asian languages. If you wish to make a complaint about the quality of the interpreter, or have any questions and inquiries, contact Jane Grant, the manager of the service. Email jane.grant@leeds.gov.uk. A poll was sent out to the group asking what are the priorities for people with English as a second language. What follows are the results. Improve access to interpreters at GP/dentist/optician, 69%. Access to GP, making appointments, 62%. Holistic maternity support for refugees and asylum-seeking women, 54%. Access to GP, register to a GP practice, 38%. Other, 8%. People who need immediate access to an interpreter, for example, when going to A&E. The second question was what will have the greatest impact for people. What follows are the results. Improve communication to people in how to access interpreters, 69%. Recording the information and communication requirements of people in a consistent way, and then meeting those needs, 69%. Making all written materials easy read or simple to understand English with pictures, 62%. Help people to understand feedback process on quality of interpreters, 31%. Build confidence and improve people's understanding of the NHS and social care services, 31%. Other, 0%. Action 7. Organisations look at the poll and issues raised today and come back to the next meeting with solutions. Wendy suggested that it would be good to link these suggestions to some of the organisations in the Communities of Interest Network for further feedback. Part 3. Impact of the withdrawal of BSL Health Access Interpretation Service. Remote BSL service managed by Sign Health. The funding for Sign Health gets withdrawn from tomorrow, and we want to hear what the impact will be for both service users and organisations. Jason spoke from a personal experience and representing the deaf community that he works with. We need instant access to interpreters rather than waiting for them to be available. There is usually a time delay with trying to get an interpreter booked at GPs and other appointments. At hospitals, some places are not aware of the interpreting services available. We hear back from the deaf community that the remote interpreting service is very valuable. A 24-hour service was ideal. For example, if we were to go to A&E at any time, it would be useful to have out-of-hours service. The service is a collaboration between Sign Health and Interpreting Now, which was funded by the government. The funding was only temporary over the coronavirus situation. It is good for people who are good at using technology, but not useful for people who are not good with technology. John updated the group on out-of-hours BSL interpreting. In working hours, BSL interpreters are arranged through the Leeds Society, but for out-of-hours, there are freelance interpreters on call. The issue is whether the staff would contact them. BSL awareness training should be mandatory, and they are looking into doing this. Interpreter on Wheels is available during office hours, as well as the Just Talk app. Jason shared an experience from when he had to go to A&E with a client as a support worker. They asked for an interpreter, and A&E would not book one. Jason could communicate okay, so ended up doing this role, but this was not what he was there to do. When they were brought onto a ward, they once again asked for an interpreter, and none was provided for days. He asked the staff to contact the Leeds Society for Deaf and Blind. Whose job is it to book the interpreter? It is a stressful and disappointing situation, and especially moving between different wards, and there is missed communication and information not being passed on. Jason found he had to keep explaining to staff that he is a support worker and they need an interpreter. A poster to provide to staff with the steps on how to contact an interpreter should be provided for everyone. John said these are common themes and complaints that we receive. Yes, all wards should have access to the lists of out-of-hours numbers, but whether they use that is something else. They do have an app called Staff Connect, but they need to get information across to frontline staff. Wendy. LTHT work with LD/autism to ensure people get the right preparation, communication and support in place for a pre-planned hospital visit, and this has made a huge difference. Is there anything similar planned for deaf/blind communities? Zyra highlighted whether people's needs are being recorded and audited, not to name and shame, but to provide training to staff who would usually meet individuals with communication needs. Not just deaf awareness training, but communication awareness training should be available. Helen has been involved in the Leeds CCG's Access for All group. They are looking into a system that can allow records to be shared and flagged. It sounded simple, but is actually very difficult to do. If they got the accessible information standard right within IT, then communication issues will be resolved. So far, no one has cracked this IT issue in this country. Charish shared that LSDBP offer an in-ward befriending via BSL through the Just Talk app. At Christmas time, posters were put up with the interpreter's details on there. The remote BSL service was useful when deaf people rang 111 and 119, trying to book COVID tests and COVID vaccines. They will support wherever they can in hospitals and GPs. They can also help with accessing an interpreter, but getting an immediate service when needed instead of having to plan for an interpreter is going to end. Carl came across a meeting where he was talking about how IT had been a problem 14 years ago, so this has been a very long-term issue. Wendy said there has been a lot of the same issues for years nationally. There is something being done on a West Yorkshire and Harrogate level to resolve these issues, but it is quite a way off. Helen said on the Leeds CCG website, under consultation and BSL interpreting, they have provided You Said, We Did session to illustrate the changes they made after the consultation. This is also translated into BSL. The following is a relevant web link. https://www.leeds.nhs.uk//your-views/Leeds/BSL/. Action 8. Tatum and Jonathan to discuss after the meeting how we will flag up issues around withdrawal of BSL Health Access Interpretation Service. Part 4. Pick up actions from the last meeting. Action 9. We will invite Elaine to report back the action from the last meeting. HWL Action Around Survey. The survey aims to find out from people with sensory impairments or learning difficulties about their current communication experiences of accessing health and care. However, people feedback that a survey can pose different access issues for the communities we try to reach. Focus groups are a better way of gathering this information. We have already conducted one focus group with people with learning disabilities. However, is it worth continuing to do the focus groups, given the discussion we just had? Requesting further feedback without opportunities for organisations to take follow-up actions will feel tokenistic and hinder the work we collectively put into this. The group agree that we have already gathered enough information on people's experiences and not enough has changed, partly due to the pandemic slowing progression. So information will probably remain the same. People will not want to repeat discussions. The group agreed that we should take a "you said, we did" approach and ask organisations to act on the information we already have. What we are looking for is IT improvements and training, and after that point we should go out and consult after the changes have been made. Focus of next meeting and roundup. Thank you to everyone for your contributions today. We know what the problems are for deaf, blind and learning difficulties. We are learning more about language and culture, and hopefully we can start problem solving these issues. Next meeting is on the 27th of May. The original plan is to revisit AIS agenda, but there will be a combination of AIS and people whose first language isn't English. We will update everyone on the agenda nearer the time.